Well, the first large study to assess cardiovascular outcomes 1 year after COVID infection has demonstrated that the virus, well, the impact is often lasting. It was an analysis of more than 11 million U.S. vets, their health records. Researchers found the risk of 20 different heart and vessel maladies. It was amazing, absolutely amazing. More than 77 million Americans have had and recovered from COVID. And those are just the cases recorded by the government. And I guess if we're honest, the number's likely to be a lot higher. Talking with Dr. Fahmi Farah from the Dallas-Fort Worth area. She is a cardiologist. And, if people have this and don't realize it, they feel pretty good. They don't have the headaches and all the symptoms of being infected with COVID. They may think, okay, I'm okay, no problem, no harm, no foul. How do they find out, doctor, if their heart was damaged by COVID? How do they do that, first of all?
The first thing to go by is symptoms. So some of them will have some symptoms like chest pain, shortness of breath. Palpitation is a very common symptom that we're seeing in a lot of young folks as well. So if they're having, with little activity, if their heart rate is going up and they feel tired, fatigue, those are all signs. If they're having swelling of their legs, all those things warrant a checkup with their doctor or cardiologist. The other thing is athletes. These are young, very fit people. A lot of them are asymptomatic with COVID, but then when they're going back to play sports, they're not able to function as well. That's how they're finding out that, okay, there's something wrong. So a lot of schools, what they're doing right now, even high schools, is they're actually requiring their students to go get a cardiac evaluation done before they are allowed to get back in the field. And I think that's a very smart idea just because of, like you said, as we're discussing, that some of them are completely asymptomatic until they're doing strenuous activity. So those would be a start point. People who have risk factors like high blood pressure, diabetes, cholesterol, or pre-existing heart conditions who've had COVID, they should be more inclined to get their heart checked just to make sure that it has not done any damage or that they don't have anything underlying.
Yeah, and we're not suggesting people panic, but we are suggesting you become more aware of the possibility that even though you were infected and thank God you got over it, there still may be a few things that you need to watch for. I know that my cardiologist, Dr. Weiss, he sends me in on a routine basis to have, I'm not even sure what it's called, you would know, but it's where they do an ultrasound of your heart to determine, whether the structure is improving and so on. And it's very non-invasive. It takes a while, but it's non-invasive. And we're not suggesting people run right out and do everything under the sun, but just be aware because the numbers here are staggering. And we really don't know the long-term effects, do we?
We do not. That's the scary part. And the test that you're referring to is called an echocardiogram. Correct. An echocardiogram is actually, as you said, it's a completely non-invasive test, very easy, very simple, fast, but it can give us a lot of information when it comes to COVID. For example, one of the things COVID is causing is inflammation of the heart muscle. The medical name for it is myocarditis. What myocarditis does often is it causes, the inflammation causes fluid to build up around the heart. And just with a simple echocardiogram, we can see if that inflammation exists in the heart. And it can help so much for people to get just a simple checkup, especially for athletes.
And that would run along the lines of pulmonary edema. And medication for that, I mean, is pretty easy. There's a lot that can be done, correct?
A lot that can be done, yes. We have great medications. We have great treatment strategy. It's just a matter of being diligent in terms of paying attention to what symptoms you have and getting to the physician in a timely manner to seek help.
I suppose we shouldn't be surprised when we have something like this, and I guess it was too much to hope for. Well, you got it. The infection's gone, you're over it, you feel fine. I guess it was too much to expect that, you could wash your hands and say, okay, I had my run-in with COVID and it's all over. There may be some of those people, but this study of 11 million people, it's a pretty scary report, isn't it?
It is. And the thing is, we've known about this. We just didn't have the data, but like a formal set of data. But, throughout the pandemic for the last 2 years, I've been treating hundreds of patients. And we've just been overwhelmed with cardiac patients, even young ones after COVID. They're coming in with heart failure. I just saw less than 30-year-old, a 20-something-year-old patient came in with complete heart failure, ejection fraction of 15%, which is like a heart. Wow. The heart is almost not functioning at all. Severe heart failure. Just like that, we've seen many others with myocarditis. We've seen fluid around the heart, which is called pericardial effusion. We have seen a lot of arrhythmia patients. Atrial fibrillation has become quite common. Atrial fibrillation is a very common arrhythmia that we typically see in older folks who are usually above 50 and 60. But now we're starting to see them in young generation, like in their 20s. After COVID. So it's just remarkable what it has done for cardiovascular risk factors and disease process. And as you said, it's very unknown still. We don't know what the long-term implications are. We don't know how long it'll last. We don't know if more are coming. And the interesting part about the study is that they looked at people a year after as long as a year after their infection. So that's the thing. I have myself seen many patients who have had their infection more than a year ago, and they're having the heart problem even that far out.
Right. So
that's a real scary factor for me.
Dr. Fahmi Farah, I appreciate very much you spending some time with us. Huge first study, 11 people, their medical records analyzed. And we're not trying to, and thank you so much. I appreciate you being with us. We're not trying to scare anybody or create panic. Just know that just because you're over the initial infection and you're feeling better, maybe pay a little closer attention to how you're feeling and what you're doing, and talk to your doctor. See if you need to go see a cardiologist or get an echocardiogram or whatever it is. We don't want to lose anybody.